James of Westside Spine and Injury Center, and we're talking about common sense solutions to back-related and other health problems. What does that mean, Dr. James?
It means that, one of my old mentors said to me about 25 years ago, he said, when you hear the sound of hoofbeats, think of horses before you think of zebras, at least in America.
Sure.
And what he's saying is look for the common thing, the things that make the most sense versus going to the outrageous. So I like to think of myself as a common sense doctor. And, after doing this show for 2 years and having full pages in the Los Angeles Times, the reason that I do all of this, by the way, is because I've seen such tremendous results with non-surgical decompression, with patients with degenerative disc disease, with patients with bulging discs and herniated discs.
Sure.
I feel it's my obligation to educate the public to the options that they have. And what's been just astounding to me over the last couple of years has been seeing how many people are being mismanaged inside of their own HMOs and their PPOs in the insurance world, and how many solutions are being offered to them that are really unworkable and untenable and aren't really common sense solutions. How do you offer somebody a therapy before you have a diagnosis?
That very good point.
And I've got to tell you, probably 80% of the time, patients come in to me, they're offered a prescription for some sort of therapy without an accurate diagnosis. And I don't think that a diagnosis is, having an MRI and having the doctor hold the film up to a light and saying, oh, you have a disc herniation, there's your problem.
Right.
I think it's a little more extensive than that. And I think most patients in their heart, from a common sense point of view, know that there's more to it than that it can't be just that simple and have surgery prescribed to me like that.
Sure.
And quite frankly, I think a lot of patients are offended by that. They're offended by the fact that they have all this excruciating pain. The doctors typically don't have time because the systems are overwhelmed. Everybody's trying to take advantage of some sort of insurance, whether you're on the end of the, wanting to be reimbursed for it, or you're on the doctor's end wanting to be paid for it. Everybody's trying to use that system as much as possible. The system is bursting.
Yep.
Doctors don't have the time they need to go through all these things and aren't spending the time they need to evaluate. And really, what needs to happen is some common sense. Stop, sit down, ask the patient some questions about their pain, how it's affecting their life, what activities are aggravating them, where the pain is emanating from, what are the qualities of that pain. And then further, look at other diagnostic studies, and then nothing surpasses a good clinical, neurological, and orthopedic exam. That has to be done, and those things have to correlate. And when they don't, we pick up things like, for instance, I picked up a patient who had multiple sclerosis. Now, she was referred to me by another patient who had terrific results with non-surgical decompression due to a back injury. In fact, it was Scott who had spoken earlier.
Okay.
One of our previous patients. So this patient was referred to me, and things just weren't matching up. She had pain in her legs, and as I did the exam, I said, something just doesn't add up here. And we kept sending her out for more and more tests until, unfortunately, we did find that she actually had the diagnosis of MS. Now, that would have been very easy, and she did, by the way, have disc herniations in her low back.
Okay.
So it would have been very simple to look at an MRI and go, oh, well, clearly that's where the pain is coming from. The clinical correlation wasn't there. So that's what I'm talking about relative to common sense. We've got to look at things and go, does what the patient's expressing to us relative to their pain,
right,
do their symptoms match what the tests are saying? And if they don't, then as doctors, it's our obligation to look further and to see if there's anything else there.
Do you find a lot of patients come to you and they're frustrated with the healthcare system in general?
Oh my God. Everybody it seems so frustrated and so angry with the lack of solutions.
Right.
They're just, and being misdiagnosed and not finding an answer. And so by the time they get to me, often they're really quite skeptical. And even frankly, their doctors who haven't even actually afforded them any relief are telling them coming to see me is not going to be of any benefit to them. And so they come in and they're very, very skeptical.
And can you blame them for being skeptical? Because nothing has worked for them.
Absolutely.
Yeah.
And it's frustrating for me and the doctor when I know that often when I can offer a solution, that their skepticism often gets in the way of them actually receiving the treatment. Or they'll go back sometimes, doesn't happen always, but sometimes they'll go back to the surgeon who's performed 3 to 4 failed surgeries on them to ask them about the efficacy of my treatment. And that doctor say, oh, well, that won't work. But he hasn't offered them any other solutions. And so patients get really scared and get really paranoid as to what decision do I make? Listen, it's like this, Chris. Every day women and men across America and across the world are being diagnosed with cancer. You go to a cancer specialist, he says you have to start chemotherapy or you're risking your life.
Right.
And then you go to a natural healthcare practitioner who may say, if you go to that stuff is going to kill you. You have to do you have to do wheatgrass and you have to do fast and you have to do all this crazy stuff, or you're going to die. And the patient feels a little crazy in between. So there's got to be a middle ground, a common sense approach to all of these things. So first of all, in that case, I don't deal with cancer patients, but you got to deal with the emergency.
Right.
But then you have to look at the lifestyle and look at the things that might have driven that to occur in the body if it wasn't a genetic issue. And even if it was a genetic issue, we know that genes get turned on later later on in life due to a variety of different environmental circumstances. So you want to address the diet. You want to clean up. It's a wake-up call, isn't
Sure.
it, whenever you're diagnosed. Whether if you're diagnosed with back pain, it's a wake-up call. Now, further, what I've seen is in the last several years of just seeing literally just hundreds and hundreds of patients, and I have to narrow that down. There's only a very select few group of people who I can accept into our practice. While I am the premier decompression specialist in Los Angeles and have more tables than anybody to do that, I really can only select about 20 to 25 patients per month.
Sure.
It's very, very limited. So of the hundreds of calls we get, we select those down to very few people who I actually visit face-to-face with, and out of those, it's maybe 1 out of 3 who I can actually accept as a patient. And we can talk later on about what those qualifications are. But what I've also seen is a lot of other health issues that people are walking in the door with that their doctor never even spoke to them about, never even mentioned.
Really?
So they're seen as a back pain patient. Like, it's like you see the hospital shows. It's the cancer in room 2 and it's the heart attack in room 3.
Yeah.
It's a human being in that room.
Right.
And often when patients come into my office, I'm looking at them and I'm seeing all kinds of other issues with them. Often patients who actually are in my office with back pain, typically they're overweight and they're frustrated. Some patients who have been in great shape their whole life haven't been able to work out for 6 months or a year or 2 years, and they're putting on weight. And as a consequence, they're feeling like they got that little spare tire, or they're feeling a little bit chubby or a little bit fat. And even getting their diet under control doesn't seem to be able to help them to lose that, and it starts to spiral out of control. As a consequence of that, we started looking into some other technologies to help patients with that. And I've been involved, we've talked about this on the show also for the last couple of years, but I've been using lasers in my office along with non-surgical decompression for a variety of different health issues, from sprains and strains to back problems to just, severe, shoulder tears. And
it's amazing how effective it is.
Incredible.
Yeah.
Really incredible.